Special tests for knee are performed to help determine the cause of the knee pain and the treatment needed. They can help identify conditions and injuries such as meniscus torn, ACL tear, other ligament injuries, kneecap problems, and arthritis.
McMurray test for meniscus damage. With the tested knee fully flexed, then rotate the tibia medially and bring the knee into extension. Repeat the process in different angle of knee flexion in order to test the whole posterior aspect of the lateral meniscus. To test the medial meniscus, bring the knee into full flexion and laterally rotate the tibia. Positive sign indicate if there is click and pain in the knee joint. A place test. Have the patient lie in prone position. Then fixate the tested leg with your own leg and bring the knee to 90-degree flexion. Apply a compressive load to knee joint and slowly rotate the tibia internally and externally. During compression indicates meniscal dysfunction. While giving distraction, slowly rotate the tibia internally and externally. Patellar tap test or ballotable patella. To perform this test, have the patient in supine lying position with knee extended, then stroke downward just until you reach the suprapatellar pouch and press downward. With the other hand, perform the same movement and stop just below the apex of the patella while applying downward pressure. Take one finger and press onto the patella and see whether it's floating. If you can feel that the patella is floating when you are tapping, it means fluid has accumulated under it and it is an indication for swelling in the knee joint. Patellar apprehension test. To conduct this test, have the patient lie in supine lying position with knee flexed to 30 degrees. The quads should be relaxed to allow passive movement of patella. With both thumbs, press on the medial side of patella to exert laterally directed pressure. In a positive test, there will be lateral displacement of patella and feel uncomfortable or apprehensive as the patella reach the maximal lateral displacement. Legman test. To perform this test, have the patient in supine lying position and bring the patient's leg into 30-degree flexion. Fixate the femur with other hand. Bring the tibia into slight external rotation and then try to translate the tibia anteriorly. The test is positive if there is excessive anterior-posterior tibia glide. Anterior-posterior drawer test. Have the patient in supine lying position and bring the patient's hip to 45 degree and knee to 90 degree flexion. Fixate the position by gently sitting on the top of the patient. Then palpate the joint line with your thumb and try to move the tibia anteriorly in explosive movement. The test is positive if there is excessive and posterior glide.